Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, in this video we can see the next set of questions from maternity nursing. In the previous video we discussed first 15 questions and its answers. Okay, here in this video we can see the next set of questions from obstetrics and gynecology. Question number 16. A nurse has performed a non-stress test on a pregnant client and is reviewing the fetal monitor strip. The nurse interprets that the test as reactive and understand that this indicate option A, normal finding, option B, abnormal findings, option C, the need for further evaluation, and option D, the findings on the monitor were difficult to interpret. Here, the nurse performed non-stress test to a pregnant woman and the result is reactive. The test is reactive. So, what the nurse understand from this test, that is the question. So if the test is reactive means the result is normal. Okay, if the non-stress test is reactive, the non-stress test is mainly used to perform to assess the placental function and oxygenation and also determine the fetal well-being, and it helps to evaluate the fetal heart rate, a response to the fetal movement, fetal heart rate response related to fetal movement. Okay, so here the test is reactive means it is normal. If it is non-reactive means the test is abnormal. So how we are doing the test is we are counting the fetal heart rate of minimum we need 15 beats per minute lasting 15 second from the beginning of acceleration to the end. Okay, in association with fetal movement, it need fetal movement also during the last 20, they are counting or we are counting it for 20 minutes. Okay, so we are counting the first 15 second. In 15 second it need 15, fetal heart rate is 15 beats per minute is needed. Okay, then it is a reactive. If the fetal heart rate is less than 15 beats per minute for 15 seconds means it is a non-reactive. Okay, it occurs from the duration or from the counting starting to the end. Okay, and they are calculating it to 40 minutes. Okay, so here correct answer is option A, reactive means normal finding. Question number 17, pH of amniotic fluid is, and the options are 4 to 5, option B 7 to 7.5, option C 4.5 to 5.5, option D 6 to 6.5, and the correct answer is the normal amniotic pH is 7 to 7.5. And the pH of vaginal secretion during pregnancy is 4.5 to 5.5. This is also important point. Here option B 7 to 7.5. 18, number of Bartholin's duct is, and options are option A 2, option B 4, option C 3 and option D 1. So the number of Bartholin's duct present in a female reproductive system is 2. Correct answer is 2. This Bartholin's gland is also known as a greater vestibular gland. Okay, it is present on either side of vaginal opening, slightly posterior to vaginal opening, and its main function is to secrete mucus that lubricate the vagina. Okay, it produces alkaline secretion. Okay, correct answer is option B 2. Question number 19. The opening of Bartholin's duct are situated in, and options are option A uterus, option B vagina, option C vestibule and option D none of this. Here correct answer is option C vestibule. This Bartholin duct is also known as greater vestibular duct. Okay, the opening of this Bartholin duct is situated in the vestibule. Question number 20. LH surge occurs in. Options are option A during ovulation, option B 30 hours before ovulation, option C 25 hours after ovulation and option D none of this. Question is when the LH surge occurs. Okay, first we have to know what is LH surge. LH means luteinizing hormone. There is a rapid increase of luteinizing hormone in the bloodstream is known as LH surge. It occurs 32 to 36 hours before ovulation. It occurs 32 to 36 hours before ovulation. Here among this option B, 30 hours before ovulation is the correct answer. Okay, and in the bloodstream, the peak level of LH luteinizing hormones occurs in 10 to 12 hours before ovulation. This is also very important point. LH surge occurs in 32 to 36 hours before ovulation, and peak level of LH luteinizing hormone occurs in 10 to 12 hours before ovulation. Okay. Question number 21. In which year partograph is devised? And options are option A 1952, option B 1934, option B 1954 and option D 1936. The partograph is devised in 1954. Option C is the correct answer. And the next question number 22. A composite graphical record of cervical dilatation and descent of the head against duration of labor in hours is called. Options are option A cervicograph, option B partograph, option C pain graph and option D a labor graph. This is here the correct answer is option B partograph. So what is partograph? Partograph is a composite graphical a record of cervical dilatation and descent of the head against duration of labor in hours. This is known as partograph. And the next question, who first devised partograph? And the options are option A Clement, option B Robert Hornke, option C Fredman, option D Schliemann Mayer. And here correct answer is option C Fredman. In the previous question we saw the definition of partograph or what is partograph, and the year in which the partograph is devised is 1954 and the person who devised partograph is Fredman. This all year and person all are important question. Question number 24. MDP Act has been enforced in the year. And options are option A April 1972, option B April 1954 and option C April 1942 and option C April 1955. Here correct answer is option A April 1972. This MDP Act, Medical Termination of Pregnancy Act, was amended in the year 1971 and the act came into force in the year April 1972 and the act came throughout the India also 1972, April 1972. Question number 25. Font test is used to assess. Options are option A ovulation, option B pregnancy, option C cancer cervix, option D menstruation. This is one of the previous question. This question was asked in ESI exam. So the font test is used to assess and the correct answer is option A ovulation. So usually the font test is a microscopic slide test to determine the presence of amniotic fluid leakage. Okay, that is font test, and this test also provide information, that is indirect information about ovulation and fertility. Here in our question there is no option regarding amniotic fluid leakage general and option is there ovulation. So this test give indirect information regarding ovulation and fertility. Usually this is a microscopic slide test to determine the presence of amniotic fluid leakage. If it is there in the option, that is also correct. Okay. Here option A is the correct answer.